Right, welcome to another edition of Your Call. Very interesting one as well, because I've got veterinary surgeon Dr. Ralph Katzwinkel to come and just clear up a couple of issues that have been bugging a few people in the industry. And we're going to be talking about bleeding, epistaxis, EIPH, and the suspensions that go with it. Ralph, thanks very much for coming in.
Thanks, Paul.
Right, I want to let people know that I asked you to look into it for me. I haven't thrown you in the deep end. I wanted you to do a little bit of research because you know more about it than I do. But the rule on, let's just first clarify the difference between epistaxis and EIPH.
Epistaxis, by definition, is bleeding from the nostril, either one or both. So it's outward hemorrhage. And EIPH has been defined as blood evident in the trachea after an endoscopic examination, which originates from the lung. Okay, so that, I think, there is a straight difference, as Ralph has just cleared up for us. So when you hear of EIPH, you hear it in the trachea, and epistaxis when they bleed. So we've got there right now. What is the rule in this country on epistaxis? Well, in my research now, I actually looked at the Jockey Club rules, and I can't find a rule related to epistaxis. What I did find is on the web page there is a recommendation.
Just a recommendation?
Just a recommendation.
That's very strange, because if you've got a rule, they've got to fine you with a rule or hit you with a rule if they suspend your horse. Now in this country it's 3 months. So guys will come along and say, well, listen, so they haven't got a rule. Firstly, they recommend that we get 3 months and it gets passed. But for a rule to be put in place, you get guidelines, you get recommendations, you have to go through a couple of bodies. And the first body is a subcommittee. I found out that if you're going to change a rule anywhere in the country, you go to a subcommittee. The subcommittee then sits and discusses it and uses a bit of expertise. They then pass it on to the board, which entails the 3 operators, the RA, and the executive members. And they're an intelligent bunch, and that's how rules are passed. Now this hasn't got to them by the look of things.
No. So on the website, if you look under veterinary and welfare, there is a reference to epistaxis, which is a recommendation, and it's been applied as a rule.
But it's not a rule.
But it's not a rule.
That's a little awkward. So for years and years, I had a filly just for the season bleed. She won at 4 to 10. She wasn't scoped. They found a trickle, and the horse wasn't scoped. And they said, "No, give me 3 months." To contest it would have cost me 50 grand. And when you've got a horse going for those races, you think, "Sure, is it worth it?" But there was no rule.
Yeah. As you say, the concern I have is that a recommendation doesn't follow the process that a rule would have to follow to achieve something for the betterment of racing. And I think I don't want to downplay the fact that EIPH, exercise-induced pulmonary hemorrhage, is a condition worldwide in horses, in racing. So if you race, you're going to have this condition. It's so prevalent that 85 to even 100% of horses will bleed, have EIPH at some stage of the racing career. So how we deal with it for the best interests of the horse and the riders is what we need to look at.
We've got a situation in South Africa where there's a stigma about bleeding, and if a trainer can get out of the ring without, if his horses bleed, he's not going to announce his horses bleed because he's going to be hit for 3 months. If a horse bleeds during the week, he's not going to say a word about it. The stat you've just said is an incredible stat. So why don't they treat bleeding as if it was a leg injury or a back injury or a heart attack? These are major things that vets deal with, and we know we can get the complete picture by using a vet to determine the severity. When it comes to bleeding, it's a painting with a broad brush.
Yeah, that is really the point I think I'm coming from, is that we need to canvass the Jockey Club or NHRA and people in racing to have a relook at this. There's nothing in the literature that I can find, and I've done
What have you researched, Ralph? Scientific literature?
The scientific literature does not support or give any evidence of how long a horse should have off after bleeding, an episode of EIPH. There's no reference. So the basis on the 3 months, this needs to be explained, or we need to ask the NHRA to present their reasoning behind it. So I think what we've got to really look at is to say, is it a condition that occurs commonly? Yes, we do know it occurs commonly. It mustn't be swept under the carpet. I agree with you. The current rule makes it stigmatizes it. So we as vets and everybody covers up. So we don't see the extent of the problem. Horses train and they may bleed in their training and they're not identified and they race 3 or 4 days later.
So that proves it's just, they're only waiting for race day, and that's a small part of the picture.
Yeah, I think what we've also got to realize is that epistaxis, the visible blood at the nostril, is not a direct correlation of EIPH, exercise-induced pulmonary hemorrhage.
Okay, one question I'll ask you, Ralph, and others. When you get the epistaxis, there's visible blood. Does it mean it's a severe bleed?
No. That is a false assumption. I've had my own filly, same jurisdiction, ran and won in the Group 1 on Gold Cup Day. Rob gave me an option to scope her, so we brought this video.
Was there epistaxis?
There was a slight bleed in the nostril, so Rob said, do you want to scope her? So Sean, one of my vets, brought the scope down, the video scope. She was a grade 1, but had epistaxis. So, you know, what we see is an indirect correlation. To assume that visible blood at the nostril is an indication of a severe bleed is false.
Completely false.
False.
Yeah, that's people say, "Woof, you bled, it's severe. It's come out the nostrils. It's just come gushing forward," and because of that. Now, I know when you were looking at things, I took a couple of points from you. There's no literature.
No literature that supports any time off, actually.
And this, at the centre of all this, Ralph, has got to be the safety of the horse and the rider.
Absolutely, and I don't, you know, it's not for me to sit here and make recommendations of what it should be. That's going to be in the same situation as the recommendation that's currently on the Jockey Club website. A well-informed subcommittee needs to come to the right conclusion. And, you know, the fact that there's no literature doesn't mean that horses don't need a break. Inflammation is part of the reasons why horses will possibly bleed.
Can you just take people back to, there are lay people watching this, and there are people who are deeply involved in the industry. What causes bleeding? In a nutshell.
Okay, no, all right. So the lung alveoli has got very small capillaries in them, and that's where the transfer of oxygen from the air to the blood takes place. And what the theories are is that the pulmonary artery blood pressure in a horse, when they start racing and their heart rate goes up to a maximum of 240 beats per minute, the blood pressure in that pulmonary artery reaches 75 to 100 millimeters mercury. All other species, it only goes to 35 maximum. So we're looking at a 3 times higher pulmonary pressure in the pulmonary artery in a horse. Now, we don't know why, but that's what happens. Now, some of these now bleed. So the theory is that the elevated blood pressure in the pulmonary artery with the negative pressure in the airway and sucking in air into the lung causes a rupture of the little capillaries. And the rupture occurs predominantly in the caudal dorsal. So at the back under the saddle. Think about it, at the back of the saddle, in that region of the lung. That's where the bleeding occurs. And then it takes a little while to filter from that point into the trachea and then out.
What's the longest period of time have they found that a horse can show signs?
Up to 20 hours after.
20 hours can show signs.
20 hours can show signs. And generally it's between 30 and 90 minutes after exertion.
And then they do
now,
it.
EIPH is not common. It occurs in humans, occurs in racing camels and racing greyhounds. So it's a condition associated with exertion.
Yes, everything to do. Yeah. And the heart rates, they get up to 240.
240. And the acceleration is, you're looking at, from the starting pens, about 17 meters per second. So it's an extreme exertion. Now, quite a lot of work has been done on trying to find the possible causes, and so the pulmonary artery pressure is one. The other one that is getting a lot of support now in the scientific literature is the actual locomotion of the horse, the concussion of the front legs with the racing surface. So those forces where the front legs hit the ground are transmitted up the leg, through the scapula, into the thorax. and they're concentrated in the caudal dorsal area of the lung.
The back of the lung.
Yes. So think of it like playing with a whip. You have a large action with your hand to get this whip to work, and then it concertinas down to the tip, and there's your great force, and you get that crack of that whip. Now the same is happening in the thorax to the point of the caudal thin portion of the lung. Then there's another theory, an hypothesis that's been put forward quite recently in the Equine Vet Journal by a renowned researcher, is Professor Cook. His theory is that if you look at a feral horse and you take a group of feral horses and you make them exert themselves,
Which they did.
which they did with helicopters,
Yes.
none of them bleed. And the question is why? Why do they not bleed?
So they were chased with these helicopters.
and
They were
none
then
of them bled.
Recorded.
Okay.
Okay.
So his theory is, his hypothesis is that horses need to close their mouth and create a negative pressure in the oral cavity to suck down the soft palate and tissues in the back of the upper airway to allow the movement of air.
So all there is nasal.
A horse is an obligatory nasal breather. Must breathe through the nose. Must breathe through the nose. As soon as they breathe through the mouth, you have a disaster.
The choking up he's suggesting
palate
is caused when the mouth opens?
Yeah, with the mouth opens. So his
We've
belief...
got to have a bit.
Well, his big drive is to have bitless bridles,
Okay.
which we know we're not going to do. But
Not gonna.
so any opening of the mouth creates salivating. It promotes the reflexes of eating. It has the nerves in the mouth that stimulate a different reflex. And a horse should not swallow while racing.
Yes.
You don't want them to swallow.
Sure.
And if everything is in a malaligned position while racing, and they do have to swallow, they battle to correct it, and that's often when the displacement occurs. So if you get your soft tissue in the back of your airway constricted with the negative effect of breathing, the suction effect of breathing, it promotes bleeding. And his theory is that is a contributing reason for bleeders.
That's very interesting. Just getting back to the helicopter chasing these brumbies or these feral horses, is there anything to do with putting a saddle and a jockey on that could contribute?
Yeah, look, I haven't found that in the literature, and there was one reference to maybe the girth playing a role.
Yes.
Now, horses have a thoraco-abdominal respiration, so the thorax and the abdomen have to expand and contract in breathing. And there's a direct link between the action of a horse and breathing. So when the horse lands, it breathes out. When a horse floats in the gallop, it breathes in. So there's a link between breathing and locomotion. But there's no literature to support that the saddle or the rider is affecting that.
Okay. I just want to touch on the time that they suggest we should suspend horses for 3 months. Now, there's, as you initially stated, there's no reason, scientific reason, that a horse should have that type of time. How long does it take a lung to recover?
Well, the opinions are that it's very quick.
Very quick.
The lung is extremely vascular. It has, in a very crude way, it's got two plumbing systems.
Yes.
One system, blood supply, that supplies the tissue of the lung with nutrients and oxygen. And then the other important one, which is the right side of your heart, the right side of the pump of the heart, pumps deoxygenated blood to the lung where the transfer of oxygen takes place.
Okay.
And then it goes back to the left side and goes to the body. Now, there's a theory that when inflammation occurs in the lung and there's a bleed, there's a rapid healing process with neovascularization, which means new blood vessels.
So it heals quickly?
It heals very quickly.
So the 3 months, by my reckoning, is absurd. I've raced in different jurisdictions around the world, and I've chatted to Michael de Kock about it, just to name him. And when he reported that Shay had bled, they were quite surprised that he came to them. And they said, "Oh, no, that's fine, thank you." And he could have raced it the next day. There's no rule there across that part of the world where you have to say, am I getting a suspension? Is there any type of time? Some countries have, America, I know you just have to gallop back under a certain time to prove you're fine. But now we're sitting here in this country where we are not allowed to export our horses. The rest of the world basically doesn't want us. We have to use these protocols to travel right around the world. Yet we have to listen to their systems to tell us how to run our bleeding policy.
Yeah. Look, I think something has to be done about the current process, all right, and the current, let's say, no rule application. Look, I mean, I'm sitting with a situation with this filly that I've got to share in same jurisdiction. She's missed out now on the Summer Cup Day, 400,000 Group 2, and she could have been running against Majmu in the Group 1, R1 million race. Now, you know,
is it right?
Is it right? You know, it was a Grade 1. It's a bleed that we commonly see in training.
The Grade 1 bleed, not the race.
The Grade 1 bleed.
Yes, not the race.
Yes.
I can see it, and people can't accuse you of saying, well, you've got a good horse and you're fighting a cause. You're not.
No.
You know, it's happened to most people, and a lot of top horses have had the situation. But if the Jockey Club are going to have a strict rule or a strict recommendation in place, not a rule that I can find, or you, and they don't monitor what happens in the gallops at home.
That is my concern. You know, I think we have to find a way of looking at the condition in all aspects of training and racing. So the solution should be encompassing of that. I don't feel that the ban with epistaxis at the moment, or the suspension with epistaxis at the moment, actually does the industry any service.
No, it doesn't.
We need to be better than that. We need to have a better system.
If we had a system in place where bleeding was handled properly, people didn't have the stigma about, I better keep it quiet because, well, I've told my owner, my horse bled. You know, owners get suicidal when they hear that, and it's so common in horses. If we had a proper situation in place, or a recommendation in place where they said, listen, if you bleed, we will scope it and make a week or 2 week, just depending, because we know things heal, you'd find, Ralph, that people would be more open about it.
Yeah.
There wouldn't be this problem, and they'd treat it the same way as they would a horse wrapping his ankle.
You see, my view is that we're entrusted, you as a trainer and myself as a racing vet, we're entrusted with the well-being of the horse for every other condition.
Yes.
And we make decisions, fractured legs, joints, illnesses, viruses, colics, major surgeries. You know, Jet Explorer, he had a major fracture of the upper and lower jaw. He was back racing 3.5 months later.
Yeah.
You know, so he had to get fit for the race. So he was back in work probably 6 weeks later.
Yeah.
So it just shows you how resilient the body is. And what I'm getting to is that we're entrusted with the decision of the well-being of the horse and the rider for all these other conditions. We should be given that opportunity with bleeders.
Yes.
Bleeding is a condition with racing. It's worldwide. We're not going to get rid of it. It's been there for 300 years. We're not going to cure it overnight. There's not going to be, it's a multifactorial thing, and it's genetic. We must realize that work has been done in this country. PFAF in 1950 did a research, and the incidence was 1.2%. Wiedemann did research between 1986 and 2003. The incidence is now 2.1% of epistaxis, not EIPH.
Yes.
So if we...
It's going up.
It's going up. So we're not selecting in our breeding against it. We breed off speed. Speed, speed, speed.
Correct.
No selection against that. So there may be countries like Germany who's selecting against bleeding, and they have a lower incidence. So there's definitely an opportunity in our breeding to look at that. But I don't think that's practical. I don't think we've lost that cause.
Would you say, Ralph, homeopathic help is a big industry today?
Massive. And, you know, again, what we're sitting with is a no drug rule.
Yeah.
Okay, when you race under no drug rule, in other words, drug-free on race day, it opens itself to using homeopathic preparations in an attempt to help bleeding.
Help the horse.
And there's no scientific support for that. So, you know, this is where the Salix issue comes in, the furosemide.
Let's talk about Salix. For those of you who don't know, Salix, furosemide, Lasix, a lot of people would call it Lasix. It's called Salix, it's furosemide. Tell us what it does. What is it?
Well, furosemide, here's a little bottle. This is the bottle it comes in. It's 50 milligram per mil, and it's a 10 mil bottle. An expensive product, but furosemide has been shown to reduce the blood pressure in the pulmonary artery by 10 to 15 millimeters mercury. So instead of sitting at 100, it'll drop it to 85.
We in South Africa did tests to try and find out how these Lasix problems worked, and we scoped horses, Ralph, after races, and there was a South African vet, and I think three major vets came out to do their research, and they found such a huge percent were bleeding. But then they did a big test, I think you've got the literature, on horses that were given Lasix. Now it's conclusive that it decreases EIPH.
Yeah.
And
this study was done at the Vaal, and it was Hinchcliffe, Australian, Melbourne University, top authority on EIPH.
Yes.
And then Morley from Colorado and Alan Guthrie from Waterstone. And they worked, I think they raced horses 2 weeks apart.
Yes.
And the trial consisted of about 150 or so horses. And they used one bottle, 500 milligram of Salix. Now that's a high dose, but that's the dose they use in America. 450 to 500 milligram of Salix was given 4 hours before on the course, and then the horses were raced. And the research conducted in this country with our racing conditions, so everything was similar to what we practice in this country. Bleeding was reduced by 1 grade.
So it had a beneficial effect.
Absolutely. Conclusive evidence is
there are people who out there, rightly or wrongly, say that when you're giving Lasix or furosemide, you are masking other medications. Yeah. Now, this was researched deeply. What was the outcome there? Yeah. Tobin, I think it was.
Yeah, Tobin, Professor Tobin in the 80s disproved that.
Yes.
That's not the case.
He disproved all claims.
So drug detection in blood and in urine is not affected by Salix.
No effect. So those people who say, well, you'll use Lasix. You know, and there are the green people who want to have drug-free racing, but drug-free racing comes back to the problem of these horses bleeding terribly.
Yeah. You see, in the anti-racing lobby, which is getting stronger, and I think we have to be aware of that, and racing needs to be seen to be proactive. That's what I would like to see. We need to be seen to be proactive. We're not going to fix problems overnight. We're not going to cure bleeding, but we've got to be seen to be proactive. So furosemide has been shown in America to be effective. Now, I would like to see it introduced. There's no doubt about it. As a veterinarian, there's enough supporting evidence that
helps the horse.
It helps the horse. So I think if one has to answer the anti-racing lobby and say, well, we are proactive, we're doing something, and that should be considered. Yes, maybe one should have 2 races in a race meeting and allocate that to horses that are treated with Salix.
I see what you mean. Say, listen, we're going to have 2 races where horses are being treated.
Correct.
And
those for the ones that we know are bleeders. Enter them.
Enter them. You can enter them for that. And if you're a non-bleeder, you can enter, but you're going to be treated with Lasix. You would like to see something like that introduced on a small scale to start.
We will learn from that.
Yes.
You know, it's like introducing the polytrack. I mean, we're learning.
Yes,
it's a fundamental change. It's changing the form. It's changing everything. But we've made the decision. We've put the poly in. We're going with it. We should try it.
Why can't South Africa be innovators? You know, Dr. Ali Bakr with cricket was a great innovator, and wasn't for him, we wouldn't have all these technologies in place as quickly as we did. And here we've got a situation where there are going to be people against Lasix because they've got this preconceived idea that it's going to cheat.
Yeah. You see, Paul, you know, I abide by this and I agree with the drug-free, but what we mustn't forget is that the scenario where, and I'll make this, I've used this example many times. The horse is favourite for the July. He runs his best races in the prep to the July. Comes 10 days or a week out from the July, he has a little niggle, be it a joint or be it a knee or be it an EIPH or whatever. Now, I know we can help him and get him back to his best. Now, should you run this horse without help and he runs below par and affects the betting public because he now runs a poor race?
And the breeding book.
Or should you get him to his best? And that's my philosophy, is I want to see horses racing at their best. Not on drugs,
you know,
but with the help of...
The critic's going to say you can mask an injury in the leg and that by using treatments that fall within the excretion time. How would you respond to that?
I think that's being looked at, rightly so, at the moment. Intra-articulars are being looked at, and maybe the time limit between the intra-articular and race day should be investigated, or there might be a withdrawal period. But, you know, Paul, I see the condition, let's say, in a fetlock or in a knee. in a carpus, get to a point where it's affecting the horse, and by doing something about it, you're actually preventing that continuous damage.
Okay.
Now, and that's what I want to see with EIPH. I want to see the trainers report their problem, address the problem, and help the problem.
Yes.
We're not going to cure them. We're going to deal with them. We're going to manage them. So I might recommend to a trainer when I've scoped the horse, don't run this horse. Don't exercise him for 2 weeks.
Yes.
Before he comes back to racing, I want to scope him again after a gallop. We've done that with one of your horses.
Yeah, no, it has. We have to stay on top of it. I want to ask you about mortality. Now, there are records out there looking at the mortality of racehorses through different problems, and the problems can be from fracturing a leg, from breaking down so severely, from a heart attack, and from bleeding. Now, my argument is the others are way, way ahead.
Yeah, I agree. The figures I could get in the UK, they did some research on the one paper of 2000 to 2007. There were 13 deaths out of something like 14,000 starts.
Yeah.
So it's 0.08%. I think the NHRA has that data. They should present that data, and then try and identify from that data how many are associated with EIPH. It is a risk. I think we are in racing. The Jockey Club administers racing or controls racing. We are all in racing. So we choose to race. Horses are there to race. If we put them in the paddock, they're not going to bleed and they're going to break a leg.
Yeah.
But the fact that we're racing, there are inherent risks. Now, we minimize those risks. We have some of the best training tracks in the world. We have the best race tracks in the world. So our stats, I would believe, are better than most countries in the world, particularly America, for catastrophic failures. But if you look at mortality or death on the race course or closely associated after a race, most commonly fracture.
Yeah.
Okay, spinal, limb, heart attack, and then it can occur that a horse can bleed.
I've never seen a horse down from bleeding.
Well, I've asked jockeys, various jockeys and trainers who've been in racing 30, 40, 50 years, and the answer was, the question was, how many times have you seen a horse die of EIPH or bleeding? And it's either 0 or 1.
Yeah, I've
Now,
never seen it.
That's not scientific.
Yes.
Ask the NHRA for those figures. How many horses die on the racetrack? How many are associated with bleeding? And that will give us an idea of how severe that problem is. There's no doubt that it occurs, but the incidence of a horse breaking a leg and a horse going down as a result of a fracture is much higher than bleeding.
Yeah. Rob, before we wrap this up, there's a couple of points I want to put out. We've got a situation here, a horse runs and it gets a little trickle or whatever, and you basically have to go and do everything. You have to get your vet, and they haven't got a scope on the course here. You've got to phone your vet, and you've got 4 hours. So you run the last race at 10 o'clock. You've got to get hold of your vet and say, listen, I need you to scope this horse to prove that I don't get that he's hit a membrane, and that's wrong. That, in my opinion, I think should be done here, should be done quietly, and should be, if it's bled, the suspension, which I'm going to come back to you about. Do you think we should have a 3-month suspension?
Paul, the ideal is to scope horses. Ideally, maybe every horse should be scoped, but that's not practical.
Yeah.
So if you're going to say, listen, the horse that exhibits epistaxis should be scoped, that would be the right way to go. It should be graded on a grading that is used internationally, and based on that grading, you should then recommend something. And I don't want to be the one that prescribes that, but the recommendation should be made.
Well, at this stage, epistaxis falls underneath suspensions as a recommendation, as a guideline. It's not a rule.
No.
Shouldn't it be made a rule? Because that's what we are governed by the rules of the NHA, and they haven't got it as a rule.
All right. I couldn't find a rule. I then spoke to Dr. Rob Crosley, and he then took it up with Dr. Dale Wheeler in Johannesburg. And we've established there is no rule related to epistaxis. But there is a rule that gives the veterinarian a right to suspend a horse based on a recommendation to the Stapp Henry Steward.
So the staff suspended?
Correct.
But, okay, so
the vets can come along for any condition. Let's not talk about EIPH. It could be anything. And in their view, this horse may not race for X amount of time, and they'll recommend that to the Stapps, and the Stapps then apply that rule.
My problem, Ralph, is that there's no scientific proof that the X amount of time should be 3 months. Happens again, 6 months,
days.
and then you're barred for life. Every single second horse is bleeding. It's just a bad rule.
I think
or
it's
recommendation.
I think in view of what we're breeding and in view of the situation we're in, it needs to be looked at.
Ralph, thanks very, very much for your time. I hope it's cleared it up for a lot of people. There we go. Dr. Ralph Katzwinkel, just who's done all this research, looked it up and found out exactly what is scientific about it. There's nothing scientific about it. Until next time.